The article is a product of an extensive collaboration of what is called the Sustainable Markets Initiative, demonstrating that the better prevention and care not only improves patient outcomes, but also may lead to lower carbon emissions for health systems at the same time. The Sustainable Markets Initiative was established at COP26 in Glasgow back in 2021, where public and private sector organizations have come together to find ways to reduce emissions in the industry. And why is that important? Well, healthcare accounts for 4 to 5% of global carbon emissions, which is significantly higher than the airline industry, which might surprise somebody. And many health systems around the world and also health plans in the US have committed to some form of net zero emissions over the next couple of decades. Carbon emissions for medicines and devices, they're typically known as product carbon footprints. They're important for health systems because they account for 20 to 25% of carbon emissions, but they're only part of the picture. And what we have done and tried to look at is the patient carbon footprint. So the product carbon footprint is a small element of a wider thing, and we've tried to, and using the example of diabetes, try to look at from diagnosis to death all the elements that contribute to health outcomes, but also to resource use and ultimately carbon emissions here. And what we found, studying the case of prevention and improved care for diabetes in the UK, we found that the type 2 diabetes could more than half the carbon emissions related to disease complications, and good disease management could cut greenhouse gases by 21%, which is maybe not surprising, but I think it's the first time that somebody has actually tried to quantify this. In our paper, we demonstrate, in line with earlier findings, that the prevention of diabetes, in this case, not progressing from pre-diabetes to diabetes, leads to longer life expectancy. It's around 6 years, and fewer diabetes-related complications such as heart failure, kidney failure, stroke, and so on. But what is new here is that we can also estimate that type 2 diabetes prevention could more than half the carbon footprint linked to those disease complications. So not only is diabetes prevention good for patients, but it also leads to lower resource use in the health systems, even if patients live longer. I think our study shows that it's important to keep a tight grip on the parameters that you can control. The prevention intervention that we studied, evaluates that there are many things that patients can do themselves: have a healthy diet, exercise, reducing weight if you're overweight or obese, which are things that individuals can work on themselves. Sometimes it's difficult, we all know. But that might improve in themselves the health, the quality of life, and the lifespan of people. But the paper also underlines the importance of keeping your numbers in check, keeping blood sugar levels low, keeping blood pressure in check, and ensuring that lipids are low. These are things that we know, but I think we've also shown how these contribute to low risk of cardiovascular disease. So I come from Denmark, and typically we will say you need to walk on 2 feet, and you both need to focus on what you can do yourself, but also to make sure that you take the necessary steps in keeping your numbers in check. I think it's important that in the paper we find a significant reduction in long-term macrovascular complications such as heart failure, stroke, kidney disease, medical events that have a large impact on quality of life and have a high risk of reoccurrence and may lead to premature mortality. The onset of disease is a bit down the line, 8 to 12 years from diabetes diagnosis. This is a modeling exercise, so we can actually see where these events kick in. But the risk of these terrible complications is notably higher. So it is, I know that it's 8 to 12 years down the line, and many people will say, well, I mean, that's a long time from now, but some patients will listen to the opportunity to both live longer, but also have an improved quality of life, in the meantime also. So it is an opportunity to emphasize both points here. So we did not analyze this specifically in the paper, other than the fact that glycemic control, as well as controlling other risk factors, does lead to a longer life, better quality of life, fewer complications, and less resource use. But my hunch is that now we've established this from a general perspective here. I think more analysis, at least that's what I'm hoping, more analysis will emerge on specific impact of specific medications and care strategies to be able to provide even better guidance here. You can say we've laid the groundwork, and you can build on top of that, and our findings are consistent with what we see in other studies that have been done earlier. So what we've done, we looked at diabetes, prevention of diabetes, and in improved care in the UK. So it's a fairly small box, even though there are a lot of people who are both at risk of diabetes, but also have live a life with diabetes. We see that many health systems, physicians, pharmacists, patients, they worry about carbon emissions of the care, and they seek to lower it without compromising on health outcomes. Our paper underscores that prevention of diabetes and good diabetes management, is not only good for your health, but also can lead to lower carbon emissions overall, even if you live longer and do all kinds of stuff. But our hope is that our paper can inspire other therapy areas, so outside diabetes and other health systems outside the UK, to do similar analysis, and particularly focusing on long-term management of chronic disease, including the disease itself and the relevant complications that contribute most to the carbon emissions. Because it is the chronic disease management that, whether you do that well enough or not, that does affect both quality of life, longevity, and the risk of long-term complications and resource use in the health system. None other than the old quote by Benjamin Franklin, that an ounce of prevention is worth a pound of cure. I mean, translated to diabetes and improved care suggests that early investments and efforts pay off in the long run, both for patients, health systems, and, as we've documented, also for the planet.